Hi everyone, I'm Dr. Arpita Chatterjee. I am a consultant physiotherapist with Physio Wellness, Physiotherapy and Rehabilitation Center. So, do you have this pain while texting or gaming or playing any kind of racket sports around your thumb in the lower part? That is a condition which is called Quervain's tenosynovitis, also very commonly known as texting thumb or gamer's thumb. Now, what is this condition? This is actually a physical condition which affects the tendon on the sides of the thumb and around the wrist. So, we have this place where two tendons of the muscles come together and forms the anatomical snuff box. This is the place where the tendons get irritated and causes the pain while movement of thumb, in which we are doing any kind of gripping activity or grasping activity. Although we don't know what can be the exact reason for this kind of pain, but most commonly it is seen in person जो कि बहुत ज़्यादा repetitive एक activity करते हैं, जिनका racket sports या golf, racket sports जैसे badminton या table tennis, lawn tennis ऐसे games खेलते हैं. Very commonly this condition is seen in new mothers जो अपने newborn babies को nurse करते हैं, उनको गोद में उठाते हैं. दिस कंडीशन इज वेरी कॉमन इन मदर्स. अब इसके सिम्टम्स क्या क्या हो सकते हैं? यू कैन फील पेन लोअर इन द लोअर पोर्शंस ऑफ योर थंब, इन द मूवमेंट ऑफ योर रिस्ट. पेन के साथ साथ कभी कभी हमें स्वेलिंग भी दिखता है अराउंड द एरियाज, अराउंड योर lower part of the thumb, around the wrist movement painful हो जाता है. Any kind of fine motor activity जैसे कि writing और कुछ पकड़ना या type करना, if you're a pianist, piano play करना, it becomes very painful. In physiotherapy, what all exercises can be done to help with the pain and swelling in this condition? Before starting the exercises, it is important that your pain and swelling around the thumb and wrist comes down. You can use ice or heat packs for the same. Heat can help relax and loosen the tight muscles, and ice can be used to help relieve the inflammation or swelling around the area. Exercise number 1, thumb lifts. Place your hand on a flat surface of a table or a bed and move your thumbs like this. You have to lift your thumb up and down. Repeat the exercise for 10 times. Exercise number 2 is opposition stretch. So for this, you have to lift your thumb and you have to touch it to the little finger of the same hand. Again, come back. Hold this stretch for 5 seconds and relax. Repeat the exercise for 10 times. Exercise number 3 is thumb flexion. Keep your hands like this on the plane surface. You have to bring the thumb inside. Hold the position 1, 2, 3, 4, 5 and come back. Repeat the same exercise for 10 times. You can progress with the exercise by placing a little resistance from your other hand onto the thumb and then bringing it down. So with this, you can do with a little resistance, same exercise, repeat for 10 times. For the next exercise, which is your wrist flexion and extension, keep the arm flat on a plain surface. You can take a dumbbell, or if you do not have a dumbbell, you can also take a half-liter water bottle for the same exercise. Here I am using a 2 kg dumbbell, but please start with a half kg or 1 kg dumbbell if your pain is severe. First is wrist flexion. For wrist flexion, you have to move your complete wrist down and up. Repeat the exercise for 10 times. Wrist extension, from the same position you have to bring it up and down. Repeat it for 10 times. This is your wrist flexion and this is your wrist extension. Next exercise is wrist radial deviation strengthening. For this exercise, take the same dumbbell, put your fingers like so and your thumbs like so and move your wrist up. This is the radial deviation of the wrist. Repeat the same exercise for 10 times.